before I die, Amelia, because I'll be turning 50 next year,
You've still got a while.
I know, but I just want to do this for the sake of my generation, my kids, and probably you, because if we don't do it, we are, for example, we are talking about these numbers in the current generation, right? But then look around you, what we're eating,
And what people what so much is put into the food as well, like all the microplastics and whatnot.
Microplastic, the coloring agents, almost 80% of the food you're eating is not food. These are ultra processed food, And the thing is, food industry, they just say eat cereals, and then that's not a breakfast day, But anyway, we are going off the topic, But the reason I wanted to do the project was I thought I wanted to create like a template or like an operating system, Like for example, if you're a religious person, you'll be reading a Bible. There'll be like whatever the verses are there, In Quran, they have certain verses, like more like a system.
A health Bible.
Exactly. In a way, like a health Bible there, And to get this Bible going, I had to, over the last 5 years, I normally read one book per week, and then I listen to one audio book per week, and then I do read these mini books called Blinkist, which is a summary of books,
Okay.
And then, so thereby over the last 5 years, I have read more than easily 1,000 to 2,000 books,
And that's where you get most of your knowledge and structure for the program.
From there,
Obviously, as well as like medical skills and your years as doctors.
I didn't want to really only be a doctor here because doctors are very narrow-minded. I realized long time ago, when I was about 5 years ago, when my journey started, I was only focused on making money.
Okay.
I mean,
well, it's what you need to survive, especially if you move. When did you move here?
2009 to Australia. As a migrant, then obviously, you come with nothing, zero, and then obviously, first couple of years you have to really survive. One of the reasons I want to come here was. In Sri Lanka, I was, stuck in a situation. Same thing. I've always been at home. With my parents. I got married. I was not growing. I've been a very growing up a very meek and suppressed person, because my parents were there, they were dominating me, and then I know typical Sri Lanka story, I want to get out of that situation, come here, and I didn't come for anything else, just to get out of the culture and everything,
you were just stuck with being in that system and wanted to branch out.
Break out there, and then I came here, and that's my. Then after a while, during 2019 COVID crisis, and I had a good life. I had a medical center. I was making money.
How long were you running the clinic for?
About now COVID? 10 years there.
Oh wow! Yeah.
So then I realized during COVID there was this feeling we were all in that stuck in a coop situation.
Melbourne had it the worst.
And during that time, I started to complain about my life, thinking, it's too miserable, too boring, when the whole world is suffering, because it's probably being selfish, because I was only looking at the financial aspects of my life, and then suddenly I complained to my wife about how boring life is, and then within a couple of days I had a situation where my health was taken away from me. I lost all ability to even walk.
Oh wow!
Yeah, because obviously I was having a severe headache that went on for about 1 month, and then I realized when I was lying in bed without able to getting out of the bed, all the things that I really complain about, I would have loved to get my boring life back.
Yeah,
to be able
because
to
you started getting those severe health issues, really Interesting.
Yeah, then I thought obviously no point. And during that time, so I lost my health. Then I was so depressed, angry, frustrated, so I lost my mental and spiritual health,
Yeah, and you felt like a disconnect between all of it?
Yeah, all of it, yeah. And then obviously I was making money on crypto market, stock market, but then there was a meltdown, I lost all my savings and all the profit I made was all wiped off, and then so I lost my financial wealth, I was not poor, but still lost, there,
big hit for you. Yeah.
And then basically, then I realized need to do something about it. But even before that happened, I was acutely aware that something was wrong with our system of being a doctor, where we are treating only once the patient goes down, we treat. Let's say I see you now. I mean, let's say I see you as a 20-year-old, and then you start to, not you, let's say assume that you're a person who always only eat junk food, start smoking, I see you at 20, Amelia, and then I ask you questions about your lifestyle, then I can very fairly predict what will happen to you when you're 40.
Yeah.
Because I've done it for about 20 years, okay? But then we are meant to look away from you. You tell me, doc, I'm only eating fast food, I'm mostly eating fast food and drinking Coke every day, those are the patients I see in my medical center.